Are you 38 years and above? Let's look at the quality versus quantity in older women, a study done. When it comes to IVF, the success rate over the age of 38 is much lower, with fewer eggs and embryos reaching genetic testing, that is PGTA, and this offers a fascinating paradox. A groundbreaking study in China analyzed 700 IVF cycles to settle a crucial debate. Is it better to test fewer embryos for quality or keep more for multiple attempts if we not test them and keep replacing them? The results were quite surprising. With genetic screening testing, the pregnancy rate per transfer skyrocketed to 67% compared to just 12.4% for untested. The live birth rate jumped to 57% versus 7.5%. Again, remember, this is for older women. Even better, miscarriage rates plummeted down from 40% to 14.3%. Sounds amazing, doesn't it? But here's the twist. When looking at the full IVF journey, both had the same chance of similar success, which means the starting of the cycle, around 8%. Why? Because genetic screening testing is very selective. In fact, in older women, 86% of cycles ended with no embryos suitable for transfer, which means that a larger proportion of embryos are abnormal. However, those who did get to a blastocyst or got to a transfer had a better chance of pregnancy. So now think of genetic screening not as a tool to increase your chances of success, but as a quality filter. It improves your chances per transfer, but remember, reduces the number of embryos that get to a transfer. It is the classic quality versus quantity scenario. So, what is the takeaway? Genetic screening does not create more genetically normal embryos, but only makes the transfer selection more precise. It reduces, most importantly, the emotional stress by waiting those 2 weeks for a positive or negative results. But remember, you may end up not having any embryos to replace. Success rates per embryo, if it's a normal, are significantly increased. Overall success rates, whether you transfer or you screen or not screen, remains the same. But remember, if you do not screen, you're more likely to have more embryo transfer with more negative results. So, genetic screening offers work smarter, not harder approach. It's not about improving overall success, but rather making each transfer count. This study, to a large extent, highlights a crucial shift in the way fertility consultants and us seem to think. It's between the choice of precision rather than being persistent and telling couples that you keep on trying and one of them is likely to implant. This screening does put a break onto it.